This is a demonstration on how to complete a treatment plan for your patient. You will complete the treatment plan once your assessment has been completed by your instructor. Make sure that you are in the patient's chart. You will have the patient's name and the patient ID number. You will know you're in the correct patient's chart if you have the correct patient information on top right here. You're going to navigate to the upper ribbon where it says chart, and you're going to click on it. Now, this recare reminder pop-up might come up. If it does, just go ahead and press OK or close out of it. And it's going to bring you to the chart where you had already documented all of your restorations. And this is the same spot that we are going to put in your treatment plan. We need to select the services that have been discussed with you and your instructor on the treatment rationale of what you want to do. We will always treatment plan some kind of an assessment. So how you're going to do that is it's going to say INITL. If you click on this downward arrow, you're going to have the option to select the initial assessment or the recall assessment. The initial assessment is for a patient who has never been seen at Herzing University before. The recall assessment is for a patient who has been seen here before. So I'm going to select recall assessment because my patient has been here before. This will pop up. I want to make sure that it's proposed. And then I need to make sure that the provider is me. So I am going to select myself because I'm going to be the one that is going to be rendering the services. So I need to make sure that my name is in the provider box. It is clicked on proposed, so I'm going to go ahead and click OK. I'm going to want to do oral hygiene instructions on my patient, so I'm going to go ahead and click on that, select oral hygiene instructions, make sure it says proposed, and then select my name and press OK. I'm going to be doing a prophylaxis, so if you go to PRO and you have the downward arrow, you're going to have the options to do an adolescent prophy, an adult prophy, and a child prophy. My patient is 30 years old, so I'm going to select the adult prophy. Again, make sure it's on proposed, select my name, and press OK. And I am going to recommend fluoride for my patient because she has a high caries risk. So right here, FL2, if you click down on this box, you're going to have the option to do the fluoride tray application or your fluoride varnish. I'm going to select the fluoride varnish because my patient is a high caries risk. Make sure it's proposed, select my name, and press OK. Now down here in this box, you're going to see there's existing, there's conditions, and then there's proposed. If you click on status, it's going to bring all of the proposed treatment that you want to do up to the top. So it helps just kind of clean everything up. Right here is a great opportunity to make sure that what you have treatment planned is accurate. We have the date, we have our codes, we have the description of what we want to do. Everything is proposed in status, and I want to look at the amount. And I want to make sure that the amount is accurate. There are some times where there might be some discounts or maybe a free card that might change these fees. So make sure that the fees are accurate. If they are not, please go up to the front desk team and let them know, and so then they can help you correct it. But I'm going to say that this is accurate. $36 for my cleaning and $4 for my topical. So as everything looks good here, I'm going to go down to this lower ribbon and I'm going to select treatment plan. When I select treatment plan, this screen is going to come up. I am going to go to the right side and I'm going to select new plan. And in the description, we are going to be putting the date. We are going to select or click on OK. And then we have our services. Now, sometimes you're going to have more services that are going to be listed, but we're just going to click on the services that we want. Now, the other option is if it's just all of this treatment, you can just click on here, up here where it says Plan Services. If you click that button, all of the services are going to be selected, but just make sure that you only select the services that you want treatment planned. Now, once you've selected all of the correct boxes, you're going to go down to the lower left and you're going to click on Use Selected Plan Services. And it's going to bring you back to this screen. At this point, you want to present the treatment plan to the patient and make sure that the patient understands what treatment is going to be rendered and that you discuss the cost with the patient. How we're going to do that presentation is on the right side ribbon here. It says Presentation. We're going to click on that. And then it says Continue will save all plans that were modified. Are you sure you want to continue? We're going to select Yes. When we select Yes, we're going to see on top Detailed Treatment Plan Presentation. This is going to be the information that you are going to explain to your patient on everything that we're going to be doing and the costs that are associated with it. Down here, you're going to see Total Plan. So the patient is going to be responsible for paying for whatever this total is. So again, if this is not accurate, you need to stop and then go up to the front desk team and talk to them about the discrepancy. So I've explained to my patient that we're going to, we've just completed the recall assessment. We're going to move forward and do oral hygiene instructions. We're going to get their teeth cleaned. We're going to do a fluoride varnish, and the total plan is $40. Once you have discussed the treatment with the patient, you are going to close out of this screen. And you are going to go over to where it says Informed Consent, and you're going to click on New. This screen will pop up, and it's going to say Continue will save all plans that were modified. Are you sure you want to continue? We are going to select Yes. This screen is to add in the informed consent. How we're going to do that is on the right side, you're going to see Auto Note. You're going to click on Auto Note, and you are going to scroll down until you see Informed Consent Narrative, which will always be in blue. I'm going to select that, make sure it's highlighted, and then down here on this lower ribbon, I'm going to select Use. This is automatically going to put in the narrative for the informed consent. At this point, you can have the patient sign. You're going to accept the signature. You, as the clinician, are going to sign, and then your instructor is going to sign. So when you're all done with creating your treatment plan, you're going to have all of the services up here. It will say the status is proposed. You're going to have the patient's signature, the clinician's signature, you, and your instructor's signature. So you have to have all three signatures. At this point, you're going to accept the signature and you're going to create the consent. Now, when you create the consent, this is going to pop up, Patient Informed Consent Agreement, and you're going to see all three signatures down here. When you see this, you can go ahead and close out of this screen, and you can close out of this screen. The pop-up will say Clear Treatment Plan. Are you sure you want to clear all new information for this treatment plan? You are going to select Yes. Now we need to make sure that the treatment plan is in our Google Docs. So if you navigate down to the bottom, you're going to see DOC down here. If you click on that, it's going to bring you to the patient's documents. And right up here on the upper left, it says Consent for Treatment Plan. Here is the date. I'm going to click on this PDF file, And here you will see the consent form that the patient signed. You want to make sure that the treatment plan is in the Smart Docs before moving on to any treatment that you're going to render on your patient. And I hope this helped. Thank you very much.